Human immunodeficiency virus and acquired immunodeficiency syndrome. HIV stands for human immunodeficiency virus, and AIDS stands for acquired immunodeficiency syndrome. HIV has a possibility of progressing to AIDS and has a much higher likelihood of doing so when no medications are being taken. HIV is a virus that the human body cannot get rid of, and there is currently no cure available. So ultimately, once HIV is contracted, the person who contracted it has the virus for life. There are medications available that suppress the cells that are affected by HIV, but there is no way to completely get rid of the virus. The grouping of medications that are currently available are grouped under the name antiretroviral therapy, or ART. The usage of antiretroviral therapy can radically lengthen the life of the HIV-infected patient, as well as increasing their quality of life and reducing their risk of infecting others. Because of the use of antiretroviral therapy, infected patients nowadays have a virtually normal life expectancy rate. HIV is developed by affecting certain cells of the immune system. These cells are called the CD4 cells, also known as T cells. AIDS is what results when the HIV virus obliterates too many of these CD4 cells. AIDS is what results in reaching the final stage of the HIV virus. Not everyone who acquires HIV develops AIDS. AIDS is what occurs when the immune system of the HIV-infected individual is damaged to the point that it becomes incredibly vulnerable to any other infections that could be acquired. An individual is considered to have advanced to AIDS when their CD4 count becomes below 200 cells per cubic millimeter of blood. People who have advanced to the AIDS stage normally have about 3 years or so to live without any treatment, but if a dangerous infection is acquired during this time period, their time drops to around 1 year with no treatment. The origin of HIV is thought to be transmitted from a certain type of chimpanzee in Africa, more specifically Central or Western Africa. The chimpanzee form of HIV is known as SIV, or simian immunodeficiency virus. The transmission of SIV to HIV is thought to have been performed by humans in Central or Western Africa who hunted these infected chimpanzees and came into contact with their infected blood. The earliest known case of HIV infection in humans was discovered by a blood sample from a man in the Democratic Republic of Congo in 1959. HIV is believed to have then slowly spread through Africa, following then to spread throughout other parts of the world, including the United States, since the mid to late 1970s. HIV can only be spread through certain activities. It is not possible to become infected with HIV by hugging, shaking hands with, or even just simply kissing someone who is HIV positive. The only ways that HIV can be transmitted are through specific body fluids, including blood, semen, preseminal fluid, rectal fluid, vaginal fluids, and breast milk coming into contact with mucous membranes, exposed wounds, or directly into the bloodstream. The most commonly spread ways of transmitting HIV include the most riskiest, which is anal sex, and the second highest risk being through vaginal sex. Both of these risks are extremely high without the use of a condom or the active treatment or prevention of HIV using medications. The third highest risk is through sharing or becoming stuck with used HIV-infected needles. HIV is able to survive within a used needle for up to 42 days, depending on certain factors. The next, less common but still possible risk is from a mother to her child through pregnancy, during birth, or while breastfeeding. In incredibly rare but still possible instances, HIV is able to be spread through oral sex, with blood transfusions or organ transplants, by being bitten by an HIV-infected individual, physical contact between wounds from an HIV-infected individual, and lastly, with deep kissing someone who is infected with HIV while both having open sores or bleeding from within the mouth. There are 3 different stages of HIV infection. The first stage, also known as the early stage, causes many individuals to feel flu-like symptoms including fever, chills, rashes, muscle aches, sore throat, fatigue, and ulcers within the mouth. Sometimes these symptoms can last for days, sometimes for months. During the early stage, some individuals may not feel ill at all and have no idea that they have been infected by anything. Also, some individuals may not show any symptoms at all for 10 years or more. Everyone is different, and there is no precise guideline for the time or the way that early stage HIV infection is recognized. The second stage, also known as the clinical latency stage, is also known as chronic HIV infection. During this stage, the HIV is still active and still very contagious, but the difference is that it is reproducing at slower levels. The taking of medication versus not taking medication during this time could set the difference between continuing to live for several more decades and never developing AIDS, or living for about a decade or so before developing full-blown AIDS. The third stage of HIV infection is the progression to AIDS. In most people who are taking antiretrovirals, the HIV will not progress to this stage, but without the use of antiretrovirals, those living with HIV will eventually have their immune system weakened enough to progress to AIDS. The symptoms of AIDS include rapid weight loss, unexplained swelling of lymph nodes, pneumonia, red or purplish patches under the skin, within the mouth and on the eyelids, sores in the mouth or genital area, memory loss, and other neurological disorders. Many of these symptoms that AIDS cause are due to the infections and viruses that those infected with AIDS easily acquire because of their weakened immune systems. The main treatment of HIV in present day is the use of antiretroviral therapy. These medications will help keep an HIV-infected individual's viral count low and assist them in leading a life that is as healthy and as long as possible. The treatment of HIV is not being given to people around the world for many reasons. One of those reasons being the stigma attached to HIV and AIDS. People don't want to talk about it, and the fact that this stigma exists is preventing people from getting the help that they need and the help that could be the difference between life and death. The continuation of education within communities and throughout the whole world needs to be reinforced continuously to help lessen the stigma associated with HIV and AIDS and get those people who otherwise wouldn't get any support and treatment the management that they need. The increased circulation of HIV and AIDS education should in turn lead to less instances of HIV infection overall. In the past, HIV-infected individuals weren't even given medication until they were very sick, but oftentimes this was too late. Individuals who didn't physically show any symptoms were monitored at best and not given any medication until it was too late, often when the HIV had already progressed to AIDS. Research has shown that beginning antiretroviral therapy within the early stages before the HIV has a chance to progress any further dramatically increases the increased chance of transmission and the increased likelihood of maintaining the HIV. These days, the medication has been improved to cause fewer side effects, increased efficiency, be cheaper to afford, and overall be more tolerable for the individuals that need it. The accessibility of medication is increasing as well. Since this is a global issue, the efforts towards the epidemic have been increased tenfold. In June of 2015, about 15.8 million people were living with HIV have access to antiretroviral therapy out of the estimated 36.9 million people who are living with HIV and AIDS currently. This number has increased from 13.6 million having access in 2014, so even though the number of those attaining help is quite far off from the number of those infected, this global issue is moving in the right direction. There is currently also already a plan in place for the possible resistance of HIV from the current medications available. The World Health Organization has a plan in place that is estimated to be completed by the year 2020. Their target is to have 90% of all people living with HIV to have been diagnosed, have 90% of diagnosed individuals receiving antiretroviral therapy, and for 90% of those individuals to have a suppressed viral load. They believe that this plan will in turn increase the global determination of repressing the prevalence and spread of HIV and AIDS, and eventually eradicating all instances of both HIV infection and AIDS from the globe.